So the topic today is who you're going to call. So it's like a Ghostbusters theme, right? Leslie invented this as a new topic and thought I might know something about injuries and who to direct people to. And a lot of people wonder how would a doctor actually know anything about running injuries. But I've experienced a lot of them myself as well, so I can say that. So first thing I just want to ask, has anyone here ever had a running injury? Can you put up your hand if you have? So has anybody here not had a running injury? Okay. So I've heard this, and you've probably heard this too, is there's actually two types of runners. There's those that have had injuries, and there's those that lie about it. No offense. But the bottom line is runners often get injured. So, we've got to talk about that. And, at some stage, let's just say hypothetically, it might happen to you. The first thing is we want to avoid it. So prevention is the number one thing about dealing with running injuries. And that's why we're here at a clinic and why we're learning all these things about running safely and wearing appropriate clothing and footwear, et cetera, et cetera. But in the end of it all, sometimes things do happen. So if it does happen, who are we going to call? So it is a good question, and hopefully I can answer a few things about that. I'm not going to be able to answer every single question everybody has today because a lot of these things about how they work and why they work, I don't know. I mean, they work. So, we'll just have to kind of give some general principles and directions. But there's lots of different options, and I want to run through some of those options. So the first option is actually self-treatment. So, what can you do for yourself? So rest. You can change what you do because sometimes what we're doing is what's actually causing the injury. But things like using ice, using Tylenol, self-massage, so the sticks and the rollers. Questions about using ibuprofen. Things that we can do, preventative-wise, like strength training, stretching, etc., which are things that can be talked about as well. But the bottom line is we are our own best therapist, and we know what works for our own body, and I think that's what you have to judge your own treatments by, but also the treatments by other people as well. But other things, so it's pretty confusing because there's so much out there, and I mean, honestly, where does it end? So I've written a list of a few things: some massage, physio, kinesiology, personal trainer, chiropractor, naturopathic, homeopathic, osteopathic, podiatric, acupuncture, hypnosis, surgeon, witch doctor, or a friend. A lot of us have our friends as our therapists or people giving us advice. Sometimes that's good, sometimes it's not so good. So we just have to recognize that. Anybody think of any other examples I might have missed of different treatment types that you've used or that you can think might be appropriate? Shockwave treatment. So it would be part of the physio. There's different types of things like IMS and prolotherapy and ultrasound and I don't know if I said laser, but there's certainly lots of modality type things that people use.
Death works.
Pardon me?
Death works.
Death? Yeah, death is definitely a treatment. I remember I met a funeral director one time. He told me he and I were in the same business, and I didn't really understand what he meant at first, but I understand it better now. And thank you for pointing that out. Dr. Google. Dr. Google's one of the biggest treatment sources that people have and use, and I've used it. There's lots of great videos there, but we have to recognize Dr. Google has some good things, some bad things in there. And so, some of it is hocus pocus, some of it's self-promotional, some of it's selling things. But there are a lot of good things on there as well. So there's certain sites that are good, like the John Hopkins sites, the Mayo Clinic sites, those types of things are quite good. A lot of good videos as well that you can get, a lot of training advice you can get on there if you can peel through it. But even as a medical doctor, sometimes I have trouble understanding or, really accepting some of the things that are written on Dr. Google. But you certainly get some help from that. So the one thing I left off was actually the medical doctor, and nobody even mentioned that. It's funny enough. I don't know why. Well, I might have a slight bias on that, but There are some things that doctors can help with, but it depends on the doctor. I mean, doctors have different areas of expertise, different areas of interest. Some doctors will say, you hurt yourself running, well, don't run. We're not going to do that, right? I always tell people about the cartoon with the fellow coming with his leg behind his head like this, and he says, "Doc, it hurts when I do this." And of course, we know the answer to that, and that's the answer I give to people for a lot of things they do. But for running, we have to adapt and change and modify, and most people should be able to run no matter what's going on. It's just all modified. But things that the doctor can help with. So we recognize there's other health concerns, not just running. So you're running, what else is going on? Do you have cardiac issues? Do you have, issues with arthritis that we have to adapt to? Are you taking medications that might affect some of the treatments that are going on? So just being aware of that. Getting a diagnosis as well. My back hurts. My hip hurts. Well, that's pretty non-specific. We might want to get a little more specific, and perhaps the doctor can help with that diagnosis, and that might be helpful as well. Looking at whether investigations might be required or not, and we'll talk about that a little bit more. Sort out, how serious is it? Do we need to, go into some other types of treatments? Do I need to refer you to somebody different that might be able to help with that? Or can I give you some tips and advice and things that might help you at that stage? But there's always a couple of questions that come up when we talk about the doctors, and one is about medications, which I did want to make some mention of that. So, what about medication? It depends. Medications have a role, but it's a limited role. Anti-inflammatory, so ibuprofen, naproxen, Aleve, all those sort of things. People take a lot of that. We used to call it vitamin I, and it was used, I think, overused a lot. And we're recognizing a lot of difficulties and problems with taking things like anti-inflammatories. And one is they actually delay healing. So people don't actually realize that. But inflammation is part of what our body does to actually heal itself, make itself stronger. And if we suppress that by taking medication, we may be creating problems for slowing healing. Like if you have a stress fracture, a tendon injury, whatever. Celebrex is an anti-inflammatory people have probably taken. It actually causes Achilles tendonitis, so long-term problems with the Achilles. So we've got to recognize that. So they may have a role short-term, long-term not. Tylenol sometimes, but one of the things is we don't want to be masking pain to do things that are actually causing the pain. So we've got to be recognizing that as well. So cortisone. Cortisone is a thing that is used. Does it have a role? Occasionally. But cortisone is not treating the underlying problem, and that's what we've got to recognize. Anti-inflammatories, Tylenol, are not treating the underlying problem. They're basically putting some Band-Aid solutions on it, and if the underlying issue is still there, then we're going to get back into that same situation again. But sometimes short courses of treatments are necessary, because the bottom line is movement is the way we heal ourselves. So that's what we want to do, is to do things to get ourselves to a point where we can actually do the exercise and the treatments that are required to get ourselves better. So that's a term that's called passive treatment versus active treatment. Passive is what people do to us, what we do with medications, but there's no active things going on. There's no strengthening, there's no stretching, there's no coordination drills, there's nothing else like that that's happening. So the active stuff is actually makes us better for the long term. So the next thing is, what kind of tests do I need? So do I need an MRI, a CT? Everybody comes in with a sore knee, wants an MRI. Like, do we really need an MRI? Most times not. So, what we look at is for what we call red flags. So things that would say, this is a more serious injury. So it's a major trauma. You got hit by a car and your leg is sticking sideways. Okay, probably an x-ray would be worthwhile there. But, I'm running down the road. I tweak my ankle, a little bit of swelling. I'm hobbled for a while. Do I need an x-ray? No. You don't need an x-ray for that. So it's kind of defining what we need for that circumstance. I always tell people we treat people, we don't treat x-rays. And that's what we've got to recognize. And so, not to go in and ask for an x-ray every time you have an injury, because most times you don't need it. So then it's talking about the other maze of treatments that are out there. And there's a couple of key principles that I want people to be aware of. So one is, we do treat the injury. The other thing is we've got to treat the cause. So whenever you're injured, you've got to think, well, why did that happen? So part of what you often do with a clinic like this is you have a training log to say, what have I been doing with my training? I'm doing this, I'm doing that, I'm doing this. You get injured, you look backwards and go, well, what was happening before I got injured? I'll do that for myself. And then you can modify that for the next time. Or do I have some imbalances that need to be changed? Do I have some inflexibilities that need to be looked at? But there's something that may be happening that could be causing it. So we do need to treat the injury, but we always got to recognize what the presenting cause is. The other thing to know is there's no single type of treatment that's necessarily good for any injury. Sometimes there's a combination that's required for many things. So just, don't think that everybody has all the answers for you in that particular injury, like I'm going to treat everything on that person. So key things, though, prevent further injury. So that's maybe stopping what you're doing, maybe modifying the activity somewhat, maybe actually resting. It happens sometimes, not often. Splints, tensors, casts, crutches, whatever. Sometimes you need those things. But again, always focus on getting moving again. So early mobilization. If you don't use it, you do lose it, and that is a very true saying. So we talked about the difference between passive and active therapy, because what you do is the key for getting better. So number one, control the pain, control the swelling, because if we control those things, then we can move better. So that's what we want to look at. And then we focus on regaining the strength, building the endurance, building the power back again, and getting what we call neurologic function back again. So neurologic is like the nerves actually control how things move. When I sprain an ankle, what happens when that ankle is sprained, the nerves actually get damaged as well. Your brain has position sense for that ankle. So when the injury heals itself, those nerves aren't retrained again. So when my ankle rolls, the brain goes, oh, ankle rolling, pull it back again. When those nerves aren't retrained, the ankle rolls, just keeps rolling because the body hasn't controlled it. So we have to retrain the body, just a simple thing, the ankles, but many other injuries as well, so it recognizes position. So it's what we call proprioception. So it's position sense. Very important, because that will reduce the risk of recurrence. Also, we don't use things, as I mentioned, we get weakness. We get the weakness, then it will make us prone to have other injuries down the line as well. So very important to work on those things as well. So the number one thing I do for people when they come in and they have injuries is reassurance. I think that is important because we're always worried that, gosh, have I broken my leg? Have I got a stress fracture? Have I got this or that? Do I have cancer? So reassurance is an important thing. But then we need to focus on individual treatment for each of the problems. So looking at other modalities for treatment, the number one thing that helps those people in that is the relationship that they have with that person. So we may have somebody, I always ask somebody, who have you seen for these injuries in the past? Somebody's seen a chiropractor, seen a massage therapist, they've seen a physiotherapist, whatever it is. If they have trust in that person, that's the thing that's going to help them get better more than anything. So it's not the specific treatment, it's the specific person in that relationship that's more important than anything. So that trusting relationship is what I wrote down here to look at. Another thing is we have to, when we are being treated, evaluate the effectiveness of it. So if you've had like 20, 30 chiropractor treatments on your sore knee, and your knee's still sore, you might want to reassess whether that's perhaps the right treatment for that. So it is important to recognize that. I always tell people 2 or 3 treatments, you should be able to tell if you're going to get some benefit. It may be minimal, but you should be seeing some progress. If you're not, I think it needs to be reassessed for sure. We look at coverage for things as well. It's one of those facts of life is things cost money. And some people have coverage for certain treatments like chiropractic, physio, massage. They'll have more treatments. But we definitely have to be aware that there are certain things that are financially difficult to do. And Roz mentioned about shockwave therapy, very expensive treatment. Works well for a lot of different things. But it costs several $100s, and is it something you can afford? Maybe yes, maybe no. So key points I just wanted to finalize is just to say we're talking prevention, number 1. Get a correct diagnosis, number 2. Find one. Is that for me? It usually happens when I'm doing something. Find someone you trust. That's very important for you. Active therapy is the key for full recovery, and correct the underlying cause is the number 1 thing after having the injury. So just be aware of that. So I'm open for any specific questions before Jeff hits the stage here. Does anybody have any questions they want to ask me? right at the very back there.
You mentioned proprioception and retraining after an injury. Is there, like, what modality are we going for to get that retraining happening?
Well, there's many, many different things. For ankles, we'll often use balance boards.
Echo the question, please.
Sorry. The question was training proprioception or position sense afterwards, and how do we do that? So many different things. So for the ankle, for instance, we'll do balance boards. So people will be on a board where they'll just back and forth, rock back and forth, back and forth. Then you may get on a stable surface like a half ball called a Bosu ball. People will do one-legged balance exercises, eyes closed, eyes open. So various things like that. And that's just thinking about the ankle, but there's many, many different tricks that the therapists have. But good question for sure. Sorry, there's another question in here.
If you have a slight injury or a nagging injury that kind of bothers you with long runs, would you recommend taking something before a race?
Did your mother ever say something like, do as I say, not as I do? It depends. So the first thing is, it'd be important to know what the cause of the injury was. So if you're running on something that you're going to make worse by running with it, and you're masking that with taking medication, then I think it's important not to run, and not to take the medication at least, so you can listen to what's happening with your body, rather than masking that. So that is concerning. So for instance, if you have a stress fracture and you go to run a marathon on it, no, I don't know who would do that sort of thing, and you took, say, some pain medication before that, and then you worsen your injury, then you're going to delay your recovery afterwards. So that's one of the concerns about that. But if you know it's a bruise, that's a bruise, suck it up, take the pain medication, you can run a little bit better, proper gait, so you're not limping as you run. I think that would be fine if you knew that's what it was. But it's differentiating that. And sometimes you honestly don't know, and you'll make a mistake, and that happens. But in general, I would say know what you're treating first. Yeah.
Last week, we did some relays with Carolyn, running flat out. I just had a ball. And I explained that to a doctor friend who came by for dinner one night, and he said, at your age, you better be a little careful about things like that. You could loosen a little plaque, you could cause some really serious problems. So how does it, and this might be helpful for other older people here, how does one know where to draw the line? Or do we need to draw the line?
Is your doctor a runner?
No, but he's a pretty active kind of a guy.
Yeah. I think that's an old school comment, honestly. If you're 100 years old, I'd still advise you to run. Like, I don't think, but what we know now is that exercise is medicine. And exercise is the best medicine.
That's what I want to hear.
Yeah, it's better than any pill that we can take, better than any therapy we can do, for sure. There's a new promotion to the medical profession in general, and it's actually called Exercise is Medicine. And I actually have prescription pads on my desk that I'll write exercise prescriptions for people of any age. And we have to modify it according to the age and underlying illness. So if you have an underlying cardiac issue or something like that, yeah, we're going to modify things. But I would not say not to exercise. I would say we'll do things differently, but not to say not to do it. And as far as loosening plaques, if you're going to cut the lawn, walk upstairs, if you're going to walk down the hall, go into the movie, you're just at high risk for those things as well. And we know the overall risk is lower for runners than it is for people who are sedentary, for sure. Now, you might have an instant increase of risk at that moment, but the overall average risk is definitely down. So
I need to select doctors when I ask questions.
Yeah, I agree. Any other questions?
You mentioned using Google. Do you have a specific site that you recommend that's better than others?
I mentioned the Mayo Clinic is quite good. Johns Hopkins is quite good. There's McMaster has some good things on it as well. Tracy might know because she's been looking at these kind of things. Tracy, do you have any particular websites that you would recommend?
Stu McGill is really good for back, safe back injuries, that sort of thing, so that might be useful.
Yeah, but McMaster, Johns Hopkins, McGill, I'm not aware of that one. those are good ones for sure. Yeah.
My son was saying that actually running is actually good for some of your joints because it actually, for people that have arthritis, it helps them break down something in the knees or something. Like there was something that was breaking down in the knees that helped with arthritis.
Yeah. Boy, we could talk for a long time. We got such great questions. So there's always that question, does running cause arthritis or not? Does it help arthritis or not? There's been some great studies out there because we obviously, everybody tells us that, oh, man, how are your joints if you're running, right? How are your joints? I get that all the time. It's like, my joints are great. The people that have arthritis are the sedentary people, the people who are not doing exercise, who are laying on the couch. And what happens with those people is they lose muscle. They don't have muscle to protect the joints, and therefore when they are doing things, tend to be heavier as well, often. So they've got muscles that aren't protecting the joints. They've got increased weight on the joint. It's going to actually wear the joint prematurely in that situation. But if you're running, you're actually building, stabilizing muscles around the joint that will protect it. There's actually studies showing that runners have less arthritis than swimmers and bikers that are matched for weight and age. And again, the feeling is that the weight bearing actually helps make the joint stronger as well. It helps rebuild the tissues around the joint as well, and the particular muscles that do help protect that weight bearing. So it's a good question. Your son is right in a way because running is protective. So I would say that the people that have trouble with running are ones that have had injuries from other sports or other things they've done. So they've torn a ligament in their leg, so their knee is unstable. So an unstable leg knee may shift a little bit, or the hip may shift a little bit. And that movement will create more problems. But again, building the muscles to minimize that movement will decrease the risk. So a lot of people have these big cruciate ligament tears that cause their leg to slide all over the place. But over time, they can strengthen the muscle. They can ski, they can run, they can do lots of things that are protective for that joint. And if they don't do those things, they're going to be worse. So yeah, exercise is medicine from that point of view as well. And definitely, I would recommend exercise even if you have arthritis. You may have to modify some of the things you do. Maybe you won't be the runner, but you certainly can help yourself for that arthritis, for sure. Got time for one more question, and then Jeff is itching to get up here. Okay, we're all good? All right, thanks everybody.
Technology in running, it's in every aspect of it. It's in your socks, your running shoes, your clothing. It's everywhere. But what I'm really going to focus on is the fun stuff. The GPS tracking and heart rate monitors. These important guys. When I first started running, the thing that was most important to me was how far did I just go? I would run around in the trails and I had no idea exactly how far I was running. And then eventually I found the road runners and I started going out to the Thursday night trails, and everybody had these magnificent watches that were telling them exactly how far they went and how many beats their heart was beating and all sorts of things. And I thought, well, that's really interesting. But I still managed to keep running without one until I started going to track. And I realized I was told at track the very first day to slow down. Because like everybody else, I thought that what you want to do is go as fast as you possibly can every time. You want to try to beat your time and get faster. I didn't realize that in order to get faster, you need to run slower. And I kept hearing people talk about heart rate zones, but I didn't understand what that meant. I'm in my zone 3 or I'm in zone 1, I'm going out for it. I'm like, what in the world are you talking about? Well, eventually, I learned that you can determine your heart rate zones by a mathematical equation, but it's not that accurate. And through Wayne and the club, they offer every couple of times a year peak testing, which is, you don't necessarily have to be an uber athlete to do this. It's for everyone. And it will benefit you to know exactly what your heart rate zones are. You want to be mainly doing most of your exercise in zone 1. And that's incredibly slow. It doesn't feel like you're doing very much. It's almost embarrassing. But I went to this peak testing, and they put a headset on you, and they pinch your nose shut, and they stick a tube in your mouth with all these sensors and put you on a treadmill, and they prick your finger, test your blood for your lactic acid. And you start running. And every 3 minutes, they test it again. And they turn up the treadmill, and you go faster. Till eventually, you just cannot go anymore. And that will tell you exactly the numbers that your heart rate zones are. And for each and every one of you, they're different. That's why that mathematical equation doesn't really work so well. But it is important that you find that out as soon as you can so that you can train better. But the most fun with these GPS things is knowing exactly the distance that you've gone. And when you come home, it loads up onto your computer, or now the new watches go directly to your smartphone. You can see a map of where you've been. There's apps that you can get as well. If you don't want to go and the expensive route of buying one of these watches, you can even now, you don't need the heart rate monitor as well, because you can get an Apple Watch, if you can afford them, that has all of that in one. But what you can do is the real economical thing, and download a free app on your smartphone. The only thing about this is that it's cumbersome, so you have to have something to carry it in. But it's going to give you all of that information, and it's really a lot of fun. There's an app on here that I like to use. It's called Strava. It's free. Strava, S-T-R-A-V-A. And it will not only tell you how far you've gone and show you a map, but it will also show the progress that you're making. If you've run that same route more than once, it'll keep a report on it and let you know if you've done it faster this time or slower this time. And you can think, well, did I eat the right foods? Did I get enough sleep? And you can sort of tweak your workouts. It also compares you to anybody else in the area that has run that same route. So if you're interested, you can see, wow, I'm almost as fast as Wayne. Wayne must have had a really bad day. But in short, and I want to make this short because we need to get out on the roads, there's a million different things out there. It's changing rapidly. But link up, find out where you're at, and have fun, because that's what we're here for. Cheers, folks.